was sitting at Wired about 15 years ago and looked around the room, and I saw nobody with any gray hair. And so I wondered, what am I going to do in the future? So I did what any English major does. I went and got a Master's of Public Health. And that led me to this observation that we make health really hard in this country. We make it incredibly challenging to lead a healthy life. And so I wrote a book about decision making called The Decision Tree, and it was about kind of how all these stuff that we've been hearing about for the past couple of days, all these amazing tools and technologies, sensors and genomics, could help drive better decision making for individuals, which is a great idea and is flourishing and helping some people, but it's not solving the problem. It's not solving the larger problem at hand. So then I did what any English major with a MPH does. I thought I'd just start a company. So I started a company called Iodine, and Iodine was about driving better decision-making around medications, because that's a really hard part of medicine. There's a lot of failure, a lot of struggle with medications. And that, again, helped some people, and then I sold it to Goetz, which is an amazing company which helps people with the affordability of medications, right? Which is a very real, tangible problem. If you can't afford a medication you're prescribed, you're not going to take it. So Goetz was able to improve that part of the decision-making process. But again, I had this kind of nagging realization that we still weren't addressing the problem. So this is one slice of the larger problem that I started to grapple with. So you just heard about this, so you'll know the answer. But if you think about U.S. children, when they reach age 35, you just heard this, 59% of them are going to be X, and X is obese, right? So we know that. So it's okay. We have medicine. We have medicines like Ozempic, right? All of these GLP-1 agonists, which are amazing drugs, and they take care of the problem, right? It's gone. For the low price of $2,500 per patient per year, and if you think about 50% of our population is going to be obese, well, that is just a nice, tidy sum of around $4 trillion. So can we afford that? Can we do that? Is this actually solving the problem? Or we can do gastric bypass, right? An amazing procedure where it actually is incredibly effective at solving the problem for many people, where you just kind of nip and tuck and the stomach disappears, which is, again, fantastic for a lot of people. But is this the way we want to solve the problem? Do we really want to put half of our population on a prescription drug for life and spend $4 trillion? Or remove and kind of readjust our internal anatomy? Is that actually solving the right problem? Obesity is just one slice of kind of the larger kind of tableau of what I've been kind of ruminating about, because it's one of many plagues, what I call plagues of modern life. These are the so-called diseases of civilization, right? These are the kind of what happens to us just by going about our everyday life as a American citizen, or oftentimes increasingly in the world, right? If you just play by the defaults, you end up oftentimes, inevitably, with one of these conditions. And this isn't the way it should be, right? These are called mismatched diseases by the amazing evolutionary biologist Daniel Lieberman. And what that means is that we've put our bodies in a context for which they are not evolved, right? It's not how we're supposed to be using our bodies. And then we expect healthcare to take care of it. And I know this slide may not rub right with a lot of you, but I think that was kind of the point I was trying to make. Healthcare is not the solution. Healthcare is not going to solve the problem. It will help a lot of people, but it's not going to fix what's going on. In fact, a lot of the ways we approach these problems is at the tail end when they've already happened, right? So yes, we have healthcare. Yes, we have lifestyle. We can ask people to change their behaviors. We can ask them to make better decisions. But that is a real struggle and a real problem. And it isn't fair. It isn't fair to ask individuals to fix the problem that society has put upon them. Or if you want, kind of go to the course of traditional public health, you look at policy. You look at policy changes, try to make changes in government regulation that might address it. But I want to put to you today that the real opportunity here is to change the products, to look at the commercial environment in which people live. If we could tackle that, if we could get better, healthier products in front of people, like you just heard about food, then we could actually start to change the fabric of civilization. So how does that happen? Well, so my co-founder at Building H, Steve Downs, came up with this phrase called the product environment, which is an analogy to the built environment, right? But if we think about the environment of all the commercial contexts in which we live our life, they're the very familiar companies that we use and consume every day. These companies, just these 19 companies, spend about $31 billion a year on advertising. So that is the default mode, right? That is the message that is being sent. So that product environment is really what we're trying to counter-program or to kind of work against. But we don't just want to kind of think about, and specifically we break it down into this framework. There's these 4 industries that we think about. So food is obviously a central one, but there's also housing, there's entertainment, there's transportation, and they correspond to these 5 behaviors that really are highly correlated with health or illness. So we look at eating, sleeping, socializing, moving, and what we call outsiding, which is just going outside. Being in nature, turns out, is highly correlated with healthy outcomes, irrespective of exercise. So that's the kind of way we've been thinking about the problem, breaking it down. But we realized we can't just be scolding companies, right? We can't just be scolding the makers of these products and services and expecting them to somehow change their priorities, change their incentives, change their profit motives, right? We need to give them the tools that allow them to actually build differently and to create better products. So the first thing we did was something of a blunt instrument, something of a hammer. It's called the Building H Index. And this came out, our first edition came out last year. We're working on the new one right now, and we'd love to enlist all of you to help us with the next version. What we did is we scored 35 companies on the framework of those, how they correspond to those behaviors. And this is a methodology that we worked out with Sarah Singer at Stanford Medical School. So as you can see, the top score is this company called Culdesac, and it's an amazing company. They're a development company, housing development, and they're building actually car-free communities. They just did one in Tempe, Arizona, and they're about to build one in Atlanta. So it's a great example of how we can actually physically build for health. We can build healthy communities. Now, on the other extreme, you see Netflix, right? Which is the worst of all the streaming companies. And it's the worst because when we looked at these 5 behaviors, Netflix is exquisitely engineered to have certain outcomes. It is designed to make you stay in your seat as long as possible. In fact, Netflix has communicated to its investors that, as you heard yesterday, that their enemy, the competition, is sleep. And they've also stated that they want to, if they're succeeding, they're going to have their customers spend less time socializing. So they are actively working really effectively at not the intended outcome, but the inevitable outcome of bad health for their users. So this is a framework that we use. We also offer suggestions for companies on how they could do better. For instance, Netflix uses autoplay. They build it in so that next video just scrolls ahead. They even do that for children's programming. So they could make that optional, right? They could make it optional for kids to not just kind of roll into the next cartoon. So those are ways that some of the companies could get better, but we wanted to give them even better tools. We wanted to give them better kind of framework for building for health. So what we were thinking about was what kind of structures or guidance could we give companies, not the ones that already exist, but the entrepreneurs, the builders, the designers who are cooking up companies right now, right? Like 250,000 tech workers, a lot of amazing engineers were just laid off. How can we inspire them to go out and build for health? So what we wanted to do was to create a framework that speaks to them in their language, that uses the vernacular of the actual builders. So this is the world of OKRs and KPIs, right? Objectives and key results and key performance indicators. I've worked at a tech company for the last 10 years. These companies are driven by the numbers and the targets they set, right? From the very top, the corner office, to the everyday workers. Everybody lives and dies by the targets they set, by the numbers that they deem to be their company's priorities. So how can we get health inserted as some of these companies' priorities. Well, what we did is we took a page, or we're taking a page, from some of the design frameworks that currently exist. So William McDonough, a very famous architect of cradle-to-cradle frame, created these principles of sustainable design. So how can you design buildings so that they're healthy for the communities and the environment, right? So that's his framework. More recently, Microsoft has been a pioneer in creating inclusive design principles. So in fact, just last week, they came out with a new edition of their inclusive design principles, which are really helping people design software that doesn't just serve the needs of a so-called normal person, but actually serves a diverse community. So these are really important frameworks. So we thought, can we do the same for health? So we're cooking up these healthy design principles, what we think is hopefully a way for an engineer or builder designer to build products in digital and physical space that actually yields health. So we want them to foster human contact, not conflict, right? We want to bring people together in a positive engagement. We want to have them be active. We want to have products that foster activity, not passivity. So leaning forward, not leaning back. We want them to be mindful of the defaults, right? Mindful of the autoplay, those kinds of little tricks that engineers know that they can put in the software, so that the opt-ins are actually better, or actually not what you need for for a healthy outcome. So if you're asking somebody to opt in for a healthy outcome, you're going to lose 95% of the people. So make it the opt-out. And then finally, obviously, the more you use, the healthier you get, which sounds simple, but is definitely not the case with most products or services we use. And finally, we want them to own the outcome. We want companies to be mindful of the externalities, what economists call the externalities of using a product. So those have to be numbers that are accounted for, that are factored for. Just like in climate change, we have things like climate taxes, right? We start to price in these unintended consequences. So these are the kind of first stab of our healthy design principles. We want your help in thinking about what we can do for the next version and how we can expand it and make it ever more useful for people. We're inspired by such amazing thinkers as Buckminster Fuller, and we want you to join us. We think that together, you can use this handy QR code. You can sign up for a newsletter. You can join our team to rate the next kind of portfolio of companies for our next edition of the index. But we think together, with your help, we can actually start to build a better, healthier civilization in everyday life. Thanks very much.
Thank you, Thomas. Great work. Are you starting to see this like spark around the world? These new, cities of the future, NEOM, et cetera, integrating this, which doesn't often happen in the more archaic, already built cities.
Yeah. So there are. I mean, there's like Culdesac. There are some amazing companies, developers who are taking the lead in this. There's some cities that, here in California, there's a huge need for new housing, and a lot of developers are thinking about how they can make that imperative for new housing be actually healthier. So those are incredibly good starts. But then you have, the rest of the country or the rest of the world, which is just building more sprawl and more of these kind of default cookie cutter environments that are not healthy. So we got to work harder.
Thanks for great work.
Thanks.
Thomas. All right.